The dreaded visit to the gynecologist. One of the most important things that a woman can do is to obtain regular pap smears. My name is Phelan, and I'll be showing you how to obtain the proper pap smear. I myself have worked in an outpatient OBGYN office for the last 5 years, in which I have assisted the doctor with many procedures as well as pap smears. Pap smears are actually the most common thing that we do in the office. Being a female myself, I have realized that maintaining your health and staying up to date with proper treatment and care is important, and if you lapse and such, that can be detrimental to your health. So I'll go ahead and I'll show you how to obtain a proper pap smear. That way, when you go into the office, you know what the doctor is doing. This is a display of the cervix, vaginal opening, cervix, fallopian tubes. When you obtain a pap smear, you put the speculum inside the vaginal opening and you obtain cells from the cervix. Some supplies that are needed for the pap smear: professional towel to lay onto the counter, a set of gloves, specimen vial, a broom, and a cider brush. Also needed is a speculum. Speculums come in various sizes. You have the medium, most commonly used, large, and small. We're going to go ahead and use the medium for demonstration purposes. You'll also need a specimen bag and a sheet for the patient to cover up with once they're undressed. To obtain the pap smear, you will first place your gloves on your hands. I would normally perform this in an OBGYN office, but due to HIPAA and patient privacy, I'm unable to do so. So we'll do it in the comforts of my kitchen. You'll put some gel onto the speculum. You'll place it into the patient's vaginal wall. You'll extend the speculum out to an opening. Then you'll get the broom. You'll go down inside the vaginal wall to the cervix, swish it around, get some samples from the cervix. You would then open this pap vial, take the brush and you swish it around in the vial. Make sure you get good sample, as so. You set that to the side when you're done. And then you go in again. This would be in the vagina the entire time. And you go in with the brush, go to the cervix, turn it around, make sure you get good sample. Take this out, set it onto the professional towel. You'll then pick up the pap vial again, swish it around, make sure you get good sample, and then you'll replace the lid to the vial. Make sure it's on there tight, that way it does not leak in the bag. Then you'll place it in the specimen bag. From there, it gets sent on to the lab, and then you'll remove your gloves. That's how you obtain a proper pap smear. Make sure to always remember that how important it is to maintain your health care, male or female, and how important it is to obtain your regular pap smears. They're usually done every 3 years as long as they have normal results. If they are abnormal, that changes the course of treatment, and you should always discuss this with your healthcare provider. Again, if you have any questions or concerns, direct these to your healthcare provider and they'll be more than happy to help you. Thank you.